Hey family, one more thing. I know I'm usually on here, and a lot of my videos are very critical of the medical industry, big pharma, companies that do dialysis and things like that. And I want to say, when I'm being critical, or I'm like really chastising, kind of whatever it is I'm chastising at that moment, it's not directed at the staff per se. It's the policies that are put in place. I was looking at Jeremy's video, my broski on here, and he was talking about like you know if your dry weight isn't after you pee, poop, and all that in the morning, then it's not a true dry weight. Like for me today, supposedly I'm 3 kilos over, but I've been a little constipated. So, that has to come into to play, and I know not every place does that. A lot of places they'll just take that weight and that's what you're getting pulled. And that's not really the policy there. But a lot of times it's policy, that really gets to me. It's stuff that's over the smaller nurses. Like I get it. Like I understand, there's with the policy of nurses and doctors, like your run, you have nurses and doctors. They have their discretion. Then above them, you have uh, whatever managers, supervisors, and then you have board, whatever, directors, people like that, and they have to adhere to local law. They have to make their own policy, draft it within local law and federal law. So I get it. I mean, it doesn't mean that it's not. It's still designed to do what it's designed to do. So that's why I'm gibberish, trying to trying to really talk and get something out, and you got dialysis brain. But if you get what I'm getting at, like, big up to the nurses, big up to the tech. Much love to all you guys, ladies, ladies and men who work the that industry, because it's not easy. It's not easy at all. You got it goes both ways though. Like I feel like people are like, oh well, I'm sick, I have cancer, I have sickle cell, I have end stage renal, so I can come in here feeling bad and talking nasty, and you just got to take it because you don't have this disease and you're here to treat me. And it doesn't work like that. Like, both parties should be courteous, because last time I was in the hospital, I heard one of the people say, like, or one of the nurses say, oh, you're like one of the nicest, sweet, softest, you know, sickle cell patients I've seen. And I'm like, really? She's like, oh, they can be like demanding and really kind of, and I get it. I know why we're like that, because of what we've been through. But also, you got to give credit where it's due. You gotta thank them. You gotta bless them when a nurse does a superior job, or does something great, or like really goes out of their way to whatever it is. I let them know that. I'm like, thank you. Just the attitude of gratitude, and vice versa. When you get in the medical field, get into it because it's something that you genuinely care about. Because if you don't, and you're just doing it for money, I see that happen. People do it for money, or a lot of times the industry and the policies actually burn people out. They're good, compassionate people. They go in there and they're like, I can't stand kids anymore, or I can't stand sick people anymore, because both parties gotta work together. People with the illness, I think in the medical field, you gotta be willing to take some of that, especially with terminally ill, chronically ill people, because that's just, I'm on end stage renal. If I don't go to dialysis in a week or two, I'm done. It's over for me. You don't have that same problem. That's a it's a big problem, and I'm coming to whatever for help. So don't be too harsh on us, and patients, don't be too harsh on them. If you're going to do things or try to remove someone, go through the proper channels. Ask who you got to ask about whatever. Like me, I'll file a formal complaint so that it's on paper. I want my receipts, for all of that, and I'll call a few people that I know who are higher up, who can help me resolve the situation. But I'm not gonna act out and start throwing chairs and beds and whatever, in there. Just doesn't make sense, because you're not going to get nothing done. You're just going to get kicked out, you're going to get banned, and you're not going to be able to get care from there anymore. So it only hurts you in the long run. But following the proper complaint channels and doing what you got to do is shoot. If people say that, oh, they're still not doing nothing, I've talked to the president of this hospital or whatever, or the chair. If they're still not doing nothing, you can call your state, local representatives. Call your mayor, call your council people, call your there has to be some sort of health or medical liaison type of people out there. Call them. Make noise. Call your governor, your state people. That's what they're there for resolving issues like this. And generally they don't like calls of people complaining, and you get enough people complaining about a certain issue, then it gets handled. But my whole message, or me ranting and talking, was to say that big up to the healthcare workers. I know I'm harsh on you. Not harsh, but hard. I know sick people are just hard on you guys, but when you guys do good things and encourage and all that good stuff, I love it. And I just want to say, your job is super hard. It takes a lot to do. Not everybody's built for it. Don't get in it for the money. Get in it because you're compassionate and you really care about people. And don't let the policy and the systems break you, because they will, even us as patients. So just keep that in mind, folks. And again, I'm getting ready to take my nap that I said I was going to take 8 minutes ago. So everybody be blessed. Ciao.